So today's conversation is going to focus on how tobacco interacts with alcohol and other drugs of abuse, potentially making quitting tobacco more difficult without taking steps to reduce other or quit other substances. Molly Leis and Heather Kraling-Coons are both experts on polyaddiction. They're from Mayo Clinic's Nicotine Dependence Center through their partnership with the Truth Initiative and the X Community. Welcome, Molly and Heather. We're really glad to have you here today. Why don't you tell us a little bit about yourselves, and maybe we can start with you, Molly.
Okay. Well, my name is Molly Leis. I am a nicotine dependence counselor currently. Before this, I was an alcohol and drug counselor here at Mayo Clinic for several years. And I've been working with addictions and mental health for my whole career. So this is near and dear to my heart. And when I came over to the Nicotine Dependence Center about 4 years ago, this was an area that I really was passionate about when I discovered how nicotine can really interact with some other drugs of abuse, as well as some prescription medications as well. So it's a really interesting topic, and especially prevalent for those, that are quitting smoking, just knowing how those drugs can interact when you're trying to quit.
Great. And Heather, what about yourself?
Yeah, so I'm Heather Kraling-Coons. I also work in the Nicotine Dependence Center right along with Molly. I've been at the Nicotine Dependence Center for about 5 years now. I really did not know much about nicotine dependence until I actually started in this area, but it really has become something that I've grown really passionate about throughout my time here working, because just recognizing that more people die from tobacco-related illnesses than anything else. And I don't think a lot of people recognize that. And in addition to treating people for tobacco dependence, a lot of times they are also using other substances. And it's something that we really have to take into consideration when we're working with them. So thank you. I appreciate being here today.
Well, we're really glad to have you both here as part of the X Community's quarterly programs that we're doing with the Mayo Clinic. And this, of course, will be available as a replay in the community and on our YouTube channel as well. But in the meantime, for anyone that happens to have logged in on the webinar here itself, we're taking your questions. Please add them to the chat or the Q&A section. I'll be monitoring them throughout the session, and we'll try to get to as many questions as we can after the more formal part of the discussion that we have here. I think we're going to take this in two parts today. The first part is going to be with Molly, and she'll be talking about the impact of nicotine use via smoking or vaping when used with other drugs of abuse, including alcohol. And then for the second part, we'll be talking to Heather a little bit about some specific strategies to address treating both or multiple substances. So Molly, do you want to go ahead and kick us off?
I can, yes. So to get us started, we have to talk about what the problem is, right? And so the issue is like when we're using nicotine or tobacco, many times there can be other drugs that are used along with those. And it could be, just here and there, recreational. I mean, there's a lot of people that, drink alcohol recreationally, right? And so what is the impact on that when we're trying to quit smoking, vaping, chewing tobacco, as well as prescription medications like opiates? Some people are on those for pain management. What is the impact on that? But also, with the increasing legalization of cannabis, can I use cannabis? Can I use medical marijuana? What are some things that I need to take into consideration? Is this going to affect my ability to quit smoking? So I just want to talk a little bit about just like what the interactions of nicotine are with some of these drugs. So to start with, alcohol, which is probably the most common drug, it is, right? And the most common drug that we use, and a lot of people use recreationally, and some people obviously get addicted to it, as we know. And it's interesting to see kind of how nicotine interacts with alcohol. Alcohol and nicotine really do go hand in hand. We have a residential program here at the Nicotine Dependence Center. And well, we did. Now it's called the Intensive Tobacco Treatment Program. and people stay in a hotel. We have classes all day long. But it was in a building and people, it was a residential type setting. But we asked people to not drink while they're here, while they're trying to quit tobacco. And there's a reason for that, because when you're trying to quit tobacco, nicotine and alcohol do really go hand in hand. Nicotine enhances the effects of alcohol. Alcohol also enhances the effects of nicotine. They can also take care of the withdrawals for each other. And as well as they cause cravings for each other. So when people are trying to quit tobacco and they're drinking, it can increase their cravings for alcohol, because what happens is that when you're smoking, or well, let's just say like you start drinking, right? And it increases your cravings for smoking. And so you smoke a cigarette, and what that does then is it helps with the withdrawal from the alcohol. When you start to come down on the alcohol, you can drink more, but it also enhances the effects of the alcohol and makes it feel better too. So it's an interesting combination. And so if you can stop using alcohol for at least a little while, even if you're not addicted to alcohol, it really can improve your chances for tobacco cessation.
And Molly, when you say if you could stop for a little while, is talking about like a day or a week or a month? Like how long should someone be off?
That's a good question. I think it's different for everybody. Some people, there's also an association too, because people associate drinking with smoking too sometimes. So whenever I go to the bar, I smoke cigarettes and drink, so can you go, can I have that drink? Is that going to just cause a mental craving? Besides the physical craving, is that going to cause a mental craving? So I think that, for some people, they steer clear of it for a few months. Some people steer clear, maybe just like, for 6 months, it just as long as you've like, some people mostly they'll try it out again, have a drink and see if it increases their cravings. And if it does, then, maybe just back off for a little while. Would you agree, Heather?
Yeah. In general, though, we do recommend that people try to abstain for about 3 months, because that's really how long it can really take to rewire the brain. And so because a lot of times people are looking for a time frame. They want a definite time. Yeah. And so we'll say, if you can stay abstinent for 3 months, that's good. So that's what we encourage.
Yeah. Oh, I love that. And it was the reason I posted the question, because I've seen that sort of thing come up in the community before, where people will ask, well, how long does that actually mean? How long do I need to wait?
Right. Yes. So is there any more questions about the alcohol?
So we had a comment from someone on the webinar. Tim asks, if someone can still enjoy alcohol without relapsing to smoking, is that okay? I know lots of people who don't want to quit both. Right.
Yes. Yeah. No, that's a good question. And like I had said, it's really you have to be very careful, and just paying attention. And I think that's the main point, is that we really just want to pay attention. Is this causing, more cravings? Or or can I enjoy this? And it really doesn't have anything to do with the smoking at all, So yeah, paying attention, not just trying to ignore it.
Absolutely. Right. Oh, well, thank you.
Yeah. Okay. So then in talking about cannabis, like I had mentioned before, the cannabis is one of those drugs, like it's becoming more legalized in a lot of different states, both medically and recreationally. So what does that mean for people who are trying to quit smoking? Cannabis and tobacco, it's a complicated association and relationship as well. Because what happens with cannabis is also when people smoke cigarettes, they usually will, actually I take that back. When people use cannabis, they will chase it with the cigarette afterwards, because what can happen is it can increase the THC levels by 45%. So you're getting more THC when you chase it with the cigarette. Wow. So and also it enhances the high. but it's always that you have the cannabis is first and then the nicotine, which is kind of interesting that it's not the other way around. But the other thing is that, the cravings, it doesn't matter which drug it is that you use first, it can increase the cravings for each other as well. The big thing that we want to, especially with teens, that we want to look at is the effects on the cognition. So we know that chronic marijuana use, when you're using that on a daily basis, it really does start affecting the cognition and your performance. It can impair your performance. And over long-term use, it actually does impair your IQ and, can take it down even up to 10 points on your IQ with chronic use. So there is an issue with cognition in marijuana. The problem is that when people are using marijuana on a daily basis, and then they are also using nicotine, it can mask that impairment because nicotine is a stimulant. Nicotine helps improve your cognition and performance and your memory. They do opposite things. So what we worry about with young people, especially with the developing brain, is that they're going to mask this with the nicotine. And we might not know that there's cognition problems even happening because the nicotine is masking those impairments. So that can be problematic. And if also when you're quitting one or the other, you're going to start to see the effects. The withdrawal effects double when you're on both of those drugs. And we've seen that before when people come into the residential program and they're trying to come off both drugs at the same time. And we can treat the nicotine, withdrawal, but they're still feeling a lot of withdrawal symptoms because they're very similar in nature. So it's really hard to tell, which one is it. I remember one lady came in and she did what she was supposed to do. She was supposed to quit a couple of weeks before she came into the Nicotine Dependence Center. And she did. And when I talked to her before coming in, she's like, oh my goodness, I'm so glad that I quit marijuana before coming in because the withdrawal was awful. And she was crying. She increased her use of cigarettes, which that happens too, because they compensate each other. Like you're going to take in more nicotine to make up for the lack of the marijuana. You're trying to just, get that, feel normal again. Right. And so it was an interesting issue, but she was so grateful that she did it because then when she came into the residential center, she could just focus on the nicotine withdrawal then. And she wasn't a heavy user. She just used like a one hitter at night. So yeah, it's interesting.
So I'm wondering, Molly, are there any complications with maybe sort of the tamer side of the cannabis-based products like gummies or things like that? Are there any concerns about being able to quit tobacco if you're taking like gummies, that are CBD or whatever? Right.
Yeah, there's always a concern because all of these drugs are narcotic drugs. They operate on the dopamine reward system. And when you're taking in a drug that is higher than what your reward system is meant for, it can affect, that area of the brain. And so sometimes if there's a defect in that area of the brain, or if that area of the brain is more sensitive to, drugs in the dopamine reward system, it can, cause more craving, So like whenever there's a drug that's like being released at higher than normal levels. So even like gummies, like it's slower, but you're still getting a high. It's still jacking up the reward system. So that's the issue there.
Totally makes sense.
Yes. Yeah. So with stimulants, nicotine is a stimulant, but then there's other stimulants out there like cocaine and methamphetamine and things like that. Nicotine does the same thing. So it enhances the high of the other. So if you're using cocaine and nicotine, it can enhance the rewarding effects of that drug. Nicotine can also reduce methamphetamine and cocaine-induced cognitive disruptions. So you might have cognitive performance problems on cocaine and methamphetamine, and nicotine can, reduce those disruptions. So it kind of attenuates that. Cocaine users also say that they use nicotine to help make them feel better physically after the cocaine use. So it's, so those two drugs, they really kind of work together as well. So there we have another drug, right? And then the last drug that I just want to talk about is just the opiate interaction. This one is pretty complicated because opiates, we can use those as prescription drugs, and some people are using those, on a more like chronic use, like a daily use or a PRN use, like as needed, right? For chronic pain or for acute pain, and what does that do? So it's interesting when these two drugs kind of interact very well, I guess I would say, because they enhance each other. They also take care of the withdrawal effects of each other. And even when people are on replacement medications, so buprenorphine, which is like Suboxone or methadone, they all do the same thing with nicotine. They all either enhance it, they take care of the side effects, they take care of the withdrawals, they just go back and forth. And here's another issue is that even with nicotine replacement, that also is affected as well. So it can increase your craving for the opiates on nicotine replacement even. So it's one of those drugs that if we can get off of both of those at the same time, like that would be ideal, right? But possibly maybe using other medications, and Heather will talk a little bit about like the pharmacotherapy piece of that. But that's a very interesting combination, because chronic pain is a very real thing, and like working with what happens with nicotine initially is an analgesic. It initially takes care of pain, but what happens over time is we become tolerant to that, and it stops working so well. But opiates do the same thing as well. But there's like a cross tolerance or a cross sensitization with those drugs. So that's kind of that's just like a brief overview of that, but that's kind of an interesting combination as well. And it has a lot of implications for a lot of different people. Yeah.
Well, thank you, Molly. A great overview. I'm sure there's going to be some more questions. Again, a quick reminder for those who are tuned in on the webinar. If you have any questions, please add them to the chat or to the Q&A section, and we'll be sure to try to get to them as much as possible. Heather, why don't we turn to you? It would be great to understand some strategies to address treating multiple substances and some maybe some things that people can try if they're finding themselves in that situation right now.
Yeah, thanks, Todd. I think one thing to keep in mind is that treatment for addiction and substance use disorder is very multifactorial. Behavioral therapy and pharmacotherapy are really the foundations for treatment, but within that, there's so many other things that need to be addressed. For example, providing good education, looking at the possibility of harm reduction, quitting other substances at the same time as tobacco, like what Molly has been talking about. Because there are numerous studies out there that show that if you quit tobacco in addition to other substances that you're using, it actually increases your rate of staying abstinent by 25 to 50%. So it really is a good thing to do. And one of the reasons that it increases your rate of abstinence is because usually, like we've been talking about, one drug feeds the other. And so staying, quitting one is going to help you stay off the other. And in addition to that is a lot of those behavioral strategies or cognitive strategies that you're using to help you stay quit. You can use them for the other substance. So if you're trying to, get off nicotine and also marijuana, it's a good thing to do them together, because a lot of those strategies, you can use them for both addictions, not just one. There's also other things that need to be addressed, like looking at support, like community support, web-based support, just like here at Become an X. These can all be really helpful. And the other really important thing to look at is, what's the person's motivation to actually quit? Do they want to quit? How important is it for them to actually quit? Do they want to quit some of their substances? So do they want to just quit nicotine? Or do they also, if they're also marijuana or alcohol users, do they want to quit those as well? So really looking at that, because if a person is not motivated to stop, then their chances of being successful is just not very likely. Another thing to look at is, what type of perceived benefit is the individual getting from the substances? Because this is really important when you're thinking about that treatment phase, because if we do not address what their perceived benefit is, it's going to likely increase their risk for relapse in the future. So an example of this would be, is we hear this really often, that, smoking decreases my anxiety, or even, using cannabis decreases my anxiety. Mm-hmm. And so if they're using that substance to do self-soothing or to help manage some of their mental health issues, we need to really look at that. We need to help the person develop some coping skills so that they can be successful. Because if you're taking away one of their main coping skills, if you don't replace it with something, it's unlikely that they're going to be successful in the long term.
There's a recurring thread or a recurring post that people keep referring back to in the community around 100 ways to distract yourself from your quit, and like a lot of different behavioral strategies like that, of like even cutting a straw to the length of a cigarette and kind of using that to even draw on from time to time, is a way to kind of pull yourself away from those tendencies to want to go back to those comfort mechanisms. And I know, and I've read posts from individuals who've said that that they will use tobacco to help them take their mind off depression, or another cognitive issue that they may have. So that totally resonates with some things that I've seen within the X community itself.
Right. Yeah. And I think too, Todd, it's that some of those things, like those 101 coping skills, those distraction techniques, they can be really helpful. They can be, just to kind of take your mind off of it so that you're not focusing on it. But the other thing is when we're talking about like self-soothing, is like they've really trained their brain that like, when I feel anxious, I smoke. Like that, and that helps me. Or when I feel anxious, I take a hit off my, take a hit off my marijuana, and so really trying to look at, okay, what's driving that behavior? What's driving them feeling anxious? Is something going on with them? Because if we can figure out what's driving their behavior, and if they can find something else to meet that need, that urge to use the substance is going to go away. I mean, distraction is always a great tool in the beginning, but it's like it's kind of like peeling the onion, trying to get down to the root of it, like what's really behind it, what's really there. Mm-hmm. Because they're using tobacco, they're using marijuana, alcohol, whatever it might be, because they're trying to cover up something. They don't want to deal with something. And so this is just an easy escape for them. If I smoke, then I don't have to deal with it. And so really trying to look at like, what can we do? Like, can we figure out what's really driving it? And then helping them find either, cognitive strategies or behavioral strategies to help them so that what they're doing is beneficial to them and not harmful to them.
Right.
That's a really great insight. I love that.
Yeah. And I'll add too, like when people are in recovery and they've, battled through multiple addictions, but smoking or tobacco use is kind of the last drug, right? Like, yes, the same strategies apply, right? But it's really hard, because when you're looking at the consequences of the other drugs, a lot of the other drugs take you out of your life, prevalently, right? And you can immediately think of the consequences. And nicotine is so much more insidious. And usually there has to be a major health issue, or something really has to affect you, because you can function fairly well on nicotine, right? So finding that why, and this is just, I think this webinar, just even what Heather said, like 25 to 50% increase of being able to stay away from other drugs, is a good reason. But finding the other why too, like, this is hijacking my brain. This is, we didn't talk too much about the mental health aspects of, all of this too, but it does have a huge impact. When nicotine in and of itself, by smoking, chewing tobacco, vaping, does affect anxiety and depression. And it does increase that. And we do know that from studies that when people stop smoking, vaping, and chewing, that the anxiety and depression levels go way down. But when we're, this is like not easily, sometimes replicated. So we really, it's an interesting issue when people are looking at this and really struggling with that and trying to figure out why is it that I'm still doing this when I really, don't want to. And this is where nicotine replacement really comes and helps settle down the receptors biologically, so that you can focus on what Heather was talking about with the behavioral strategies.
Thanks, Molly.
Yeah.
Another thing that when we're going back to treatment, one thing that we really do talk to patients about is, if they are using more than one substance. So if they are using nicotine, and then also they're using marijuana, how are they related? Because if they're highly interrelated, connected to one another, attempting to decrease or stop one of them might actually make you fail if you don't address the other substance. And because it's very often that, like Molly had shared earlier, we find that people are, they're smoking marijuana, and then right afterwards they're smoking a cigarette. And so really that smoking marijuana is going to be a trigger for them to actually smoke. And so if it's not looked at, and if it's not addressed, it is going to put them much more likely to relapse. The other thing that we see quite often when we're practicing is that patients will say that when they're trying to actually stop smoking cigarettes, they'll find that they're taking more hits from their joint, and they're using that to help basically cope with the withdrawal symptoms. And so then you're looking at, well, they maybe stopped smoking, but now they're actually smoking more marijuana. And usually what happens is they can maintain it for a few months, but then they often relapse because the trigger is just constantly there, especially if they've increased their marijuana use.
Mm-hmm.
So again, it comes back to really it being better to have a clean break with both when you quit, and then your chances of making that stick, as you said, are 25 to 50% higher. For me, that was a golden nugget, out of this conversation, because I think people who are facing those multiple addictions need to recognize like the big upside of quitting both at once, as well as the consequences, like you said, of if you just try to do one at a time, if you think you're just trying to climb over one mountain at a time, that you're probably putting yourself in for a tougher fight as a result of that.
Yeah. And really the old school of thought used to be, they used to say, if you're trying to, stop alcohol or stop cocaine, whatever, now is not a good time to actually stop smoking. And so many people wouldn't. And now, like I said, the data out there really shows that the opposite is true. People are much more successful if they do them both at the same time.
Wow. Yeah.
And we've been working hard at that Nicotine Dependence Center to get that message out, because there are still many providers out there that don't, they're still using that old school of thought. And so we have to continue to educate people about that.
Absolutely.
Yeah. Sometimes we get patients that come in and they'll say, they maybe they'll want to stop smoking, but they don't want to give up the marijuana. And so looking at it, if they are related or not. And some people will say, no, because they're not related, because I'm only smoking marijuana, on the weekends when I'm actually hanging out with my one friend, Joe. So sometimes they can be successful, but it's complicated, and really how much are they feeding off the other? And so then us just really exploring that and having a conversation with them about that. And I feel like that brings me to the point where just looking at treatment really needs to be individualized for patients. It's no cookie cutter approach. It's really exploring everything with that person and trying to figure out what they're able to do and what they're willing to do, not just what's looking good on the paper, or not just how you treated your last 5 patients, because everybody is very individualized. Everybody needs different things.
Right. Yeah. I like how thanks for saying that, Heather, because, that the association between the two drugs is an important aspect of that, because you want to, make sure that you are, kind of decoupling that use, right? So if, like what you were saying, if somebody's just using on the weekend, they may have no association with the smoking, but if they are, smoking the cannabis and then chasing it with the cigarette for that enhanced high, those two things are very closely related. And without quitting both of those, they may have a very difficult time just quitting one substance, right? So we make these associations in our mind every day of certain things. We put things together and it's just automatic. So decoupling this relationship between the two drugs is really important to focus on when you're trying to, quit.
Yeah, definitely a great point. Heather, these behavioral strategies are really interesting. And there was a question I wanted to acknowledge from the attendees here. Someone asked, I've heard of people being told not to quit 2 things at once, which we addressed. Why do you think they're being told this? It's an interesting question.
I think it just goes back to that old school of thought. I mean, that's just what they thought in the beginning, and kind of focus on one thing at a time, and then you'd have a much easier time being successful. I think also a lot of times what ends up happening is many of these programs are not smoke free. So a lot of people, if they're in an addiction program, the staff members are out there smoking in addition to the people that are participating in the program. So it's beneficial for the people working there, and it can be beneficial for the other people as well, trying to stop the addiction, because like we've talked about, what they're doing is they're trading one addiction for another. So they're self-medicating through the nicotine as they're trying to wean off of alcohol or pot or, cocaine, the other things. And so they're using it to kind of help them self-regulate in a different way.
Right. And we also know that the tobacco companies historically have funded research to ensure that, people do not stop smoking or using tobacco during mental health treatment or, substance use treatment. And so, the source of that research that we've seen, through the tobacco trials and revealing that is very telling of, the tobacco companies are not trying to get people better. They're trying to keep people hooked.
Yeah, that is. And, Molly, since you brought up mental health, I think that's another thing when you're looking at to see if the person does have any undiagnosed mental health issues. Because studies have shown that tobacco users that have mental health they require longer and stronger treatment.
Mm-hmm.
And they also require a lot more support. And the other thing is to think about, when they're stopping nicotine, it may interfere if they're taking some medications for their mental health, some psychotropic medications, it might impact them. They might need more, they might need less. And so being able to look at that, and then also, to talk to them about that, about talking with them to their psychiatrist, the person that's prescribing the medications, to see if they need some type of medication adjustment.
Right.
So that's really important too.
Yeah, good point, because when I go and talk to patients who are in substance use treatment about tobacco and quitting, and I tell them, it can increase your chances of the anxiety and the depression. We know that the studies say that those will go down, and the effects of that were, equal to that of taking an antidepressant. But do not stop taking your antidepressant because you stop smoking. But it is just something to know, like, yes, it'll get better, but, talking with your psychiatrist or your physician about, what does that mean for you? Maybe the antidepressant treatment works better, now that you're not smoking, because we do know there are a lot of medications that are, that don't work as well because the tobacco smoke interferes with the absorption of those medications. So overall, medications work better when you stop smoking.
And just talking about medications, it is important if you're trying to stop tobacco, it is important for you to consider medications for cessation. We know that medications will actually double people's chances of quitting. So again, increasing their chances of quitting by using medications that are out there. And when I'm talking about medications, I'm talking about nicotine replacement. And then there's 2 actual pills that people can take as well for tobacco cessation. One of them is called bupropion, Wellbutrin, or Zyban, and the other one is called Chantix or varenicline. So those medications can be extremely helpful for helping people, because what it does is it actually takes care of those withdrawal symptoms so that it can give that person the opportunity to really work on those thoughts and behaviors that they have attached to their smoking.
Yeah,
and
I know that those medications have definitely come up as points of conversation in the X community, and your insights on these are very welcome. Thank you.
One final thing that I want to talk about is that thinking about harm reduction that's out there. And this is not usually a goal for most people. Most people want to actually stop. They want to quit because they want to reduce their overall risk. Mm-hmm. But if that's really not, exploring with the person, what are the pros and cons for their ultimate goal? If you look at smoking, if their goal is never to stop smoking, then harm reduction can be reasonable to look at. And one of those things would be looking at the possibility of vaping, because with vaping, you're not actually bringing carbon monoxide into your body. So you are decreasing the risk by switching to vaping, or switching to smokeless tobacco. That could be another thing about harm reduction. The other thing, the thing about it is that when you're looking at harm reduction, and if they're still using the nicotine or the substance, their brain is still getting hijacked because of the quick delivery of the nicotine, but they are reducing some of the risk. And so sometimes we do have to explore that with patients. Of course, we want total abstinence, but sometimes that's not the goal for the patient. I know for marijuana a lot, because marijuana and smoking really go hand in hand, or marijuana and vaping really go hand in hand. A lot of times we spend a lot of time talking about the carbon monoxide and how it impacts your body overall, and that it would be beneficial that if they do want to keep using marijuana, to then explore edibles or explore tincture, or just explore doing it in a different way. Because if they're going to stop smoking, but they're going to still continue to smoke marijuana, they're still bringing that carbon monoxide into their body, and that's still harmful for them. That's still putting them at risk. And so we really spend some time talking with them about using alternatives. Even though that's not our primary job. I mean, we do take the time to do that because we want them to be successful in the end. Yeah. And so we want them to, have health benefits.
Right. Yeah. Harm reduction used to be a swear word, for addiction counselors. And I think that over the past few years, it's really come full circle because, there's a lot of people who really, really struggle with complete abstinence. And so do we just say like, well, you can't, since you can't have complete abstinence, like, then we can't help you, So, and, like what Heather was saying and really looking at, are there alternatives? And if you can, we keep working with them, to see if that helps, but if they can, come down at least one level, right? Maybe they feel the confidence that they can go down even more, well, if I can stop smoking and vape, maybe I can, do nicotine replacement, like maybe this isn't impossible. If I can, use like an alternative form of a drug, that's like decreasing my health risks, maybe I can do something else. Right. So it's one of those, it's not really controversial subject, but like, our whole goal with being counselors and, being in this field is that we want people to be completely healthy, but I don't think that we can ignore, the nature of addiction, how powerful it is and how it has a hold on people. And the fact that we really want to work with them the best that we can to make sure that, they're getting the best possible care. And however long that takes, and like what Heather was saying, like if there's multiple addictions or if there's mental health issues, like it might take, a long time, 6 months, a year, but we just keep going.
Yeah. Yeah. I mean, it really, all of these things, stopping any type of substance use, it really is a process. It's not an event. And we need to really keep that in mind when we're working with people and also reminding people that, I mean, you're going to have good days, you're going to have bad days, but what's really important is that you just keep trying. And that's really what, we love doing what we do and we love supporting people. Yeah.
Well, that's a really terrific message, I think, for us to maybe wrap up on here. You've both been terrific in sharing your experience and your wisdom and your understanding of this complex issue. And I'm grateful to you both for spending a little time with me today. I thought, as we kind of wrap this up, maybe each of you might like to give just a quick word of encouragement to anybody or a final thought before we close the webinar for the day. Heather, do you want to start us off?
Well, I just feel like I kind of did.
Yeah.
I mean, really, it is. All of this really is a process. I mean, it really is. And you have to be, you can't be hard on yourself, treat yourself like you treat a friend. The other thing is to make sure as you're trying to do stuff, make sure that you're setting yourself up for success and not failure. If you're trying to implement some behavioral strategies, make sure there are things that you want to do, that you like to do. And just know that there's lots of people out there to help you.
I knew you were going to have something else, because that treat yourself like a friend is a great bit of advice. I appreciate that.
Yeah.
Molly, any closing thoughts from you?
Well, I guess I would just reiterate what Heather said. Don't give up. This is something that doesn't happen overnight, but utilize help. Whenever you can. Use the Become an X community, use each other. Addiction is never overcome by yourself. We need each other, and we need, help from help from professionals as well. Finding a tobacco treatment specialist and finding a doctor or physician, that can help you with medications, because they do really increase chances for quitting. Yeah, that's what I would say.
Yeah. Well, that's a great place to end things on. We all need a hand up from time to time, whether we're suffering from an addiction or not, but especially if we're in a situation where we're trying to quit a drug as powerful as tobacco, and especially when it's combined with other kinds of drugs or treatments that we're undergoing. So thank you both so much for your time today and for your insights. We're going to have this replay available within the X community as a follow-up. And if you are not familiar with the X community, if you're just coming across this on YouTube, we invite you to go to becomeanx.org, and you can join the X community, where you can get access to a variety of quit-based information about getting off of tobacco-based products and vaping. You can get moral and emotional support from others who have been through what you're going through at this time, as well as a wealth of fact-based information from the Mayo Clinic Nicotine Dependence Center and from the Truth Initiative itself. So thank you so much for joining us today for this. As I said, we'll post this in the community. If you have questions there, we would love to continue this conversation with you there. And in the meantime, we wish you well on behalf of X.